Hello and welcome to Retire Rich, Tales of Financial Freedom podcast with your host, Carlos Lopez. I'm your producer, RJ Malik. Carlos, how are you?
I'm doing well. How are you doing, RJ?
Doing well. I see you have a guest. Why don't you introduce your guest?
Yes, this is Louis Kowalski. He's one of the main gentlemen from the field marketing organization that handles Medicare.
Excellent. Excellent. Louis, welcome.
Thank you. Thank you very much.
Carlos, why don't you get this thing started?
Sure. I just wanted to introduce Louis, and I wanted to kind of just introduce who he is and what his background story is. So, Louis, tell us a little bit about yourself.
Well, thank you, Carlos. I've been in the insurance business for, you're not going to believe this, for 50 years. I started when I was 24 years old in Austin, Texas, with New York Life, and moved to my hometown of Laredo. I'm a border rat, so I moved back to Laredo in 1976, and basically was in Laredo from 76 to 83 doing life insurance, but then I morphed into group health insurance. We were group health insurance brokers for about 35 years and got very, very involved in the healthcare industry. I went to Texas A&M, born and raised in Laredo, Texas. Been married to my wife, Lisette, who's Puerto Rican and a doctor. We've been married 28 years, and we have three children. So about 7 years ago, I was looking around and I realized that most people didn't know anything about Medicare, including me. When I signed up for Medicare 9 years ago, I was totally in the dark, had no idea what was going on, and I'd been in the group health business for 35 years. So about 7 years ago, I decided to go into Medicare basically to help people. I was getting a lot of calls. I didn't know what to tell people. I'd have to refer them out. And frankly, I wasn't too happy about the people I was referring them out to. And so 7 years ago, I made the leap to go into Medicare and basically did it, number one, to help people learn how Medicare works. That is if I ask 100 people how Medicare works, do you know how Medicare works? 100 people will tell me no. That goes from CEOs to just regular people. Nobody knows how Medicare works. It's crazy. So we got in the Medicare business, number one, to help people understand how Medicare works, and number two, to guide them to the right solution for their Medicare problems. And that is basically how we work. Number one, to help people. Today, my organization, we have about 150 agents all throughout Texas and Georgia, and we're continuing to grow, and it's a business that I totally love. I've been in the real estate development business. I've owned 3 restaurants. I've done pretty much everything business-wise you can think of. Right now, the only thing we do is Medicare, and we absolutely love it.
Excellent. Is it confusing for most people?
Medicare is very confusing for most people. And we have just a short 10-minute presentation that basically explains how it works. And the question I like to ask most people after the presentation is, did this help? And everybody says, oh my gosh, now the fog is lifted, and now I know I can make the right decision.
In your opinion, Louis, what is the best Medicare plan and why?
Well, that determines on the individual, Carlos. We sit down and we ask a lot of questions. Number one, is a person, do they have a doctor? Do they want to keep that doctor? Number two, are they on meds? If they can share it with us, we'd like to know what meds they're on so we can steer them to the right plan. There's 2 types of plans that are available. There is a Medicare Supplement, which is called a Medigap. Everybody knows about Medigap, and people today can either buy a Plan G or a Plan N. And what those plans do is pay whatever Medicare does not pay. Okay, they are not Medicare. They're issued out of a private company, but they're called Medigap Medicare Supplements. With that, you would couple it with a Medicare prescription drug plan. The other plan that's immensely popular today, and by our latest figure, 56% of people that are Medicare eligible are enrolled in a Medicare Advantage plan. A Medicare Advantage plan is Part C of Medicare. It is Medicare. And it contains Medicare Part A, Part B, and Part D all in one. And a lot of Advantage plans have additional benefits like dental, vision, transportation to and from the doctor, health club memberships. So the two ways you can go are either Medicare Supplement or a Medicare Advantage plan. So we sit down and through a series of questions and visiting with people, we find out where they want to go. Not only that, we show them how each plan works. We break it down so that they understand what they can do, which is the most important thing. And then we let them make the decision. A lot of times the question I get is, well, which plan should I go with? Not up to me. That's up to you. This is all the information. If you don't understand it, let's go over it again so you have a clear understanding, and that way you can make a decision.
So I've got a question, Louis. I'm on my wife's medical plan, and I'm 63. When can I switch over to Medicare?
That's a great question, RJ. In fact, I was visiting with somebody about that just yesterday. Under group health insurance, we call that group health insurance. You're on your wife's medical plan. That is considered credible coverage. All right, so you can stay on there as long as you want. I'm talking about you can stay on there till 70, 75, 80 if you want to. Most people want to get off of that because it's expensive. Typically, the employee is having to pay 50% of the premium. The employee's dependents have to pay 100% of the dependent premium, which can oftentimes be $350, $400, $500, up to $1,000 a month. It can get very, very expensive. So you can come off of your wife's plan when you turn 65. Now, the rules are before you turn 65, you have to apply for a Medicare A and B card. Okay, basically you're applying for Medicare Part B. All right. You have 3 months before your 65th birthday, the month of, and 3 months after to get that done. I recommend that people get that done way ahead of time, 3 months before, because Social Security Day is very slow and you don't want to have anything impeding you on having the choice to do that. But yes, you can do that.
Okay, but I plan on working after, for quite some time. I don't really plan on retiring. So is that going to affect my Medicare?
No, sir, will not affect it at all. You can work as long as you want. Medicare is Medicare is the way to go when you turn 65.
Okay.
Group health insurance is very expensive, and we can help people through that process. I've gone into companies and work with companies, and the rules are changing for that. So if anybody has a company and they want to explore that possibility, have them contact Carlos, and we can go from there.
Sounds good. All right.
Did that answer your question?
Yeah, it did. That was really good information. That's something my wife and I have been discussing. She's a little bit younger than me, so she'll be working with her company for a couple more years. And she's looking at me going, okay, how much longer am I going to carry this deadbeat? So
the other thing that we face, RJ, is we have a Medicare beneficiary turning 65 and his wife is 55. All right. So what do we do? What do we do in that circumstance? There is the Affordable Care Act, Obamacare, and what we do is we show them all the plans available for her, and we can go from there. So nobody is going to be uninsured.
Right, but my option would be Medicare.
Yeah, your option would be Medicare. Correct.
Okay.
And Carlos can help you with that.
Yeah, I can. What about dual enrollment for Medicaid and Medicare, Louis?
Okay, that's a really, really good question. A lot of people don't realize that there are what are called dual plans available. If somebody is on Medicaid, all right, at 65, it turns into what's called a premium savings plan, and you can you can enroll in a dual plan with several companies. And the rules are changing for dual plans. And what I mean by that is Medicare, Medicaid. And since the rules are changing so much, you need to get with a trusted advisor like Carlos and go over the rules, okay? Because it's going to affect a lot of Medicaid beneficiaries. Medicaid beneficiaries want to be on dual plans because of the additional benefits they can get and the freedom of choice as far as doctors are concerned. So if somebody is on Medicaid and they're turning 65 or they're on Medicaid and have a dual plan, contact Carlos, and Carlos can help you because the rules are changing on that.
What about our veterans? What can you say about veterans that look for help?
So veterans that have VA, all right,
Hmm.
VA sets itself apart from Medicare. In other words, they don't what's the word? They don't combat each other. You've got
Right.
one here and one there. So if somebody's going to VA, I always like to tell veterans use Medicare and a Medicare Advantage plan as your backup plan. Since they don't infringe upon each other, it's fantastic. So they can have the VA, do the VA stuff. They can have a Medicare Advantage plan and do that. A lot of times the VA is great. I know a lot of veterans that just love the VA. However, sometimes VA has different classifications. And if you're in the lower classification, you may want to have an advantage plan because that way you can take advantage of doctors that are not in the system and you won't have to pay. If you're in a lower classification, you do have to pay. So either way, you can do a Medicare Advantage plan or a Medicare Supplement and the VA. You have both available to you. It's fantastic. It's the best thing in the world. Now, veterans on TRICARE. TRICARE is a different situation. When you have 20 years with the military and retire and turn 65, you have what's called TRICARE for life. If there's some veterans on here, they'll know what I'm talking about. TRICARE for life is essentially the military's Medicare Advantage plan.
Right.
You can enroll in a private Medicare Advantage plan. It will become primary, TRICARE will become secondary, and you will essentially have 100% coverage. It's fantastic. So if somebody is on TRICARE or if somebody's with the VA, again, contact Carlos. He can go over that with you. It really, really is a cool deal.
What about some of the other programs like the hospital indemnity plans?
Well, Medicare Advantage plans most Medicare Advantage plans have some gaps in there. And the gaps are like a total out of pocket of say $3,900 or $3,500. Mm-hmm. What that means is when your co-pays hit that amount of money, then it's 100% from that point on. But for a lot of people, coming up with that money could be difficult. We have hospital indemnity plans that can cover that portion for very little money. It's really, really kind of a neat deal. So we can help with that. Again, Carlos can guide you into that. Mm-hmm. And not only that, cancer plans are huge.
Right.
We have cancer plans that have guarantee issue and hospital indemnity plans from 64 to age 70. If you've had cancer, you can't buy a cancer plan. But if you haven't had cancer, I highly recommend a cancer plan.
And what about supplements? I've heard that Medicare has the different supplements. How do you choose that?
Okay, so again, we sit down, we talk to people. A Medicare supplement is a Medigap plan. Okay, that's a supplement. A Medicare Advantage plan is something else entirely. All right, a lot of people call a Medicare Advantage plan a supplement. In our parlance, it's not a supplement; it's a Medicare Advantage plan. We use acronyms like M.A.H. That's a Medicare Advantage plan. We also have does that help?
Yes.
So the Medicare supplements, Medigap, would be a Plan G or a Plan N that they want to take a look at and go from there.
Okay. It seems to be getting more and more complicated as it goes along.
Yeah, and again, with our we have a short presentation. When we sit down, we go over that with somebody,
right?
Like Carlos will do with you at some point, RJ. It becomes pretty simple. Yeah, it all comes into focus, and you understand what you need to do. Remember, you have a supplement or you have a Medicare Advantage plan. Those are your two choices. All right.
Okay.
Either one. And both of them have their rules that you have to go by and things you need to be aware of. If you go on a supplement, you can always change to a Medicare Advantage plan. Okay. Because supplements premium, you pay a premium for a supplement. And the premium for a supplement with a prescription drug plan can be right at about $150 to $200 a month. All right. That premium will go up every year. So when you hit 75, 80 years old, the premiums are pretty high.
Pretty high.
And you can change at any time to a Medicare Advantage plan. You can't change from a Medicare Advantage plan to a supplement. All right? If you're 65 and you enroll in a Medicare Advantage plan, and at 70 you go, I don't know if I like this. I want to go on a Medicare supplement. I'm going to have surgery. This is going to happen. You have to go through underwriting with a supplement at that point.
Mm-hmm.
When you're 65 or coming off of group health insurance, there is no underwriting. But at that point, you would have to go through underwriting. And if there's a serious medical condition, you won't get issued.
Okay. And as I mentioned before, I'm on my wife's medical plan through her work, and it's a very good plan. So what happens if we decide that it's best for me to stay on her plan? And when she finally retires, and let's just use a number, she retires and I'm now 70. Can I now apply for Medicare?
Yes, you can. Yes, you can without any penalty. Yeah, absolutely. With group health insurance, the rules are different. All right. Mm-hmm. The two triggers for enrolling in Medicare so you don't get a penalty are number one, when you turn 65, that's one trigger. Number two, when you come off of group health insurance, that's the other trigger. But you need to sit down with an advisor at that point so he can advise you of all the options you have and how you can do it. All right. Now, if you're covered on the group, I know your plan's probably good, but there's two things you got on group health insurance, employee insurance. Number one, out of pocket. You do have an out of pocket. Number two, deductible. Yeah. You want to know what the deductible and the out of pocket are and premium. All right. Because if your premium, I was looking at a plan the other day, the gentleman is paying $380 a month premium. He's a dependent on his wife's plan. He's got an out of pocket of $8,750. So he's paying a premium of roughly $4,000, close to $5,000 a year, $4,500 a year, and he's got an out of pocket of it. He's out of pocket $12,000 before he can collect a dime if he goes to the hospital.
I see that. Okay.
With most Medicare Advantage plans, there is no deductible. They're first dollar coverage. And the copays to go to a primary care physician are $0. It's fantastic.
Yeah, that is.
What else, guys?
Well, Louis, how since you started with Medicare, how have you seen it change so much over the years till today?
It hasn't changed that much, Carlos. Thank goodness. If this is the year where there's going to be a lot of change, two things happen. Actually, three things. With the Inflation Reduction Act, number one, that came into being.
Right.
It told physicians that they were going to have a 2.9% decrease on their reimbursement from Medicare. Second thing that happened is the Medicare prescription drug plans have changed for the better, for the consumer. Mm-hmm. This last year, if you had $8,000 out of pocket, then you'd enter. If you had $5,330 total drug charges, you would enter into the donut hole coverage gap, which meant that you'd wind up paying 25% of the cost of drug. What does that mean? If you're taking something like Xarelto, which is a blood thinner, Xarelto's cost is $1,000 a month. Your cost when you enter that donut hole is $250 a month. A lot of people can't afford that. Okay. What's happening in 2025 is when you hit total drug cost of $2,000, you go to zero copay. There is no donut hole. The donut hole is going away. So because of the 2.9% decrease to physicians and that, the carriers now have more responsibility and more out of pocket they have to come up with. So Medicare Advantage plans have changed and the carriers have cut. That's caused carriers to pull out of certain areas. That's caused carriers to have to merge with others. We know which carriers that's
Right.
happening to. We can advise the client on what to do. This is the year to sit down and review your Medicare Advantage plan or your Medicare Supplement because of the changes going on in Medicare.
Is Medicare funding in jeopardy, you think, Louis?
No, not at all. No, Medicare, there's two things that are sacrosanct right now to the American retiree. Number one is Social Security, and number two is Medicare. And Donald Trump, I just read a deal the other day where Donald Trump said he will uphold Medicare and Social Security with no cuts whatsoever, which I think is good. So that's one good thing to think about.
All right. Carlos, any other questions?
No, I'm good. Thank you so much for being with us today, Louis.
My pleasure.
been great.
RJ, thank you. Carlos, thank you, guys. If you have any questions, contact Mr. Carlos Lopez. He can help you. And with Carlos comes us. We love McAllen. We love the Valley. We're there often. So let us know how we can help, and we'll rock and roll.
All right. That sounds good. With that, Carlos, how about if you give us some contact information?
Yes, I can be reached at 956 994-0407 and at Carlos at M.A.H. financial.biz.
Excellent. All right. Thank you. Louis, appreciate you joining us. And Carlos, as always, it's a pleasure talking with you. Looking forward to your next podcast. And thank you for listening to today's Retire Rich Tales of Financial Freedom podcast. Please like, follow, and share this podcast with friends and family. Until next time, for Carlos Lopez and Louis, I'm R.J. Malik.
Thank you for listening to Retire Rich Tales of Financial Freedom. Have questions about topics covered during the show? Visit our website at www.mahfinancial.biz or give us a call at 956-994-0407. Don't forget to click the follow button to be notified when new episodes become available. Investment advisory services and financial planning services are offered through Simplicity Wealth, LLC, an SEC-registered investment advisor. SEC registration does not constitute an endorsement of the firm, nor does it indicate that the advisor has attained a particular level of skill or ability. Insurance, consulting, and education services offered through M.A.H. Financial. M.A.H. Financial is an unaffiliated entity from Simplicity Wealth. Clicking the like button does not constitute a testimonial for or an endorsement of our investment advisory firm, any associated person, or our services. Clicking the like button is merely a mechanism to circulate our page. Like is not meant in the traditional sense. In addition, postings to our page must refrain from recommending us or providing testimonials for our investment advisory firm. Because the SEC and state securities regulators generally prohibit testimonials, any such postings are subject to swift removal.
The views expressed herein reflect the views of Mark Hernandez and Carlos Lopez as of the date referenced. These views may change as conditions change. The views expressed herein are not intended and should not be construed as investment advice, and they do not address any individual's specific situation.